Hi, good evening, everybody. My name is Rosita Navarrete. I am one of the enrollment specialists at Lewis Clark State College, and today I am joined by Tiffany Pilon, one of our advisors in the Nursing and Health Sciences Division. Tonight's Facebook Live is a continuation of our division information sessions that are highlighting each of our LC State divisions, sharing information about each one, and giving you guys a chance to ask questions live as well. These presentations will be recorded. So if you don't have a chance to watch it completely tonight or miss the Facebook Live, you will be able to come back to it and view it on our Facebook admissions page. Before we get into it, though, I would like to mention that we are going to be taking questions in the comments section, but would like to also remind you to refrain from posting or including any personal information like your student ID number or a social security number in the comments because it is public. If you do have specific questions, though, regarding a unique situation, you can always email us at admissions@lcsc.edu, or you can call our admissions office at 208-792-2378. All right, so with that, we're going to go ahead and get started. We'll do a quick overview about LC State, and then I'll turn it over to Tiffany, who will talk about our nursing division.
Awesome.
Okay, so a couple basics. Lewis Clark State College is one of Idaho's public four-year institutions. We are located up in Lewiston, Idaho, which is about north central Idaho, 5 hours north of Boise, about 2 hours south of Coeur d'Alene. We are part of the Lewis-Clark Valley, which is a valley combined of Lewiston, Idaho with Clarkston, Washington. So this picture right here is one of my favorite pictures. It kind of shows a really nice aerial view of what the valley looks like. That chunk on the left-hand side is Lewiston, Idaho, and then across the river, that's kind of heading north and south, you have Clarkston, Washington. So we are right on the border between the two states. Population of the entire LC Valley is about 55,000 people. Lewiston on its own has closer to about 35,000, but it is definitely a great area for anybody who likes to be outdoors, likes to go fishing, hiking, swimming, boating, things like that. We are also, Lewiston, Idaho is also only about a 45-minute drive from Pullman and Moscow. So if you have friends in the area that are at the University of Idaho or Washington State University, or you're a student considering coming to LC State from one of those schools, it would be a pretty easy transition because we are very close to that area. So a couple reasons about why Lewis Clark State College and why you should definitely consider LC State. LC State is still a pretty affordable option for students who want to save some money. We do have the lowest cost of tuition out of the public four-year schools here in the state of Idaho. So with that, it's kind of nice. Our cost of tuition for Idaho residents is only about $7,000. And for students coming out of state, we also have some waivers that will knock down the cost of tuition, including the WUI waiver, which is worth about $5,200 per semester. LC State is a very small school. That is also something that we're very well known for. Right now, we have about 3,700 students at our school, which allows us to have a class ratio of about 15-1 student to teachers. That is also kind of nice because our class size tends to be pretty small. Our average class size is only about 25 to 30 students. And with that, you can definitely count on having a lot of one-on-one attention with your professors, having a chance to connect with your peers a lot easier, and just have a chance to be a lot more successful as well. Right now, one of our statistics that we really like to highlight is that we do have a 97% placement rate for our graduates going on to graduate programs, finding a career related to their major after graduation. So it's pretty exciting. You can definitely know that you're going to be pretty well off after finishing at LC State. Okay, and so that is kind of what I have for the overview about Lewis Clark State College. And from here, I'm going to turn it over to Tiffany, who will go ahead and get started with the nursing program.
Awesome.
And nursing and health sciences.
Yep. Thanks, Rosita. So nursing and health sciences, we have a nursing degree and we have radiographic science degrees. So we are training future nurses and then future x-ray techs, which may go on to then get certified in other modalities. We have a CT bachelor's and a radiography bachelor's. So first, we'll start off with talking about the nursing side of things. The only nursing degree we offer is the Bachelor of Science in Nursing. So that typically is your 4-year degree. We do have 4 different pathways to get there. And so I'll just briefly explain the pathways, some careers, misconceptions. We'll talk about radiography. And then at the end, if you have any questions, let me know. If, again, like Rosita said, if there's something specific, you can reach out to us individually. And our email address will be at the end too. So just to get started, well, we have what we call, it's been called our basic track. It's a traditional pre-licensure nursing program, and this would be for someone that wants to become a nurse, and they are, looking to come to school for that 4-year college experience. Typically, it is 2 years as a pre-nursing student and then 2 years in the nursing program. So you may do your freshman and sophomore year working on those prereqs and then apply to get into our program for the pre-licensure. And then if admitted, you'd be here for your junior and senior year in theory. We have room for around 50 to 60 students every semester. So every fall and spring, we have a new cohort of students that come in. We've been able to grow the seats in our program, and at least for the last 3 cycles or so, we've had room to admit every eligible applicant. So good grades are still important. We do have minimum GPAs to apply to that. So you would want to make sure that you're doing well. We do take a lot of transfer students, and that's a big question I get is how many transfer students do you take? Is there a cap? So meet with me or get in contact with me and we can talk more in depth, but we have room, and if you want to be a nurse, let's find a way to do that. So that's our pre-licensure. Anyone that already has an LPN, which is a licensed practical nurse, if you have that credential, we have an LPN to BSN track that is here in Lewiston. It's not online. It does have some online course options and some part-time options if you really need to continue to be working as an LPN while you're going through nursing school. So we have that. We have a community college partnership. We call it our CC to BSN track. And currently that is a partnership with North Idaho College, College of Western Idaho, and newly coming up this summer is the College of Eastern Idaho. So nursing students in those associate degree programs, we have a partnership where you can start taking bachelor courses even before you've graduated at that associate program. So it's very accelerated. It does mean that you're not going to have summers off, and it's quite rigorous, but it's very efficient. And timeline wise, you're going to have your BSN usually within maybe a summer and a semester after graduating from your associate college. Next is just the RN to BSN, and this would be someone who already has their license. You may be at a school that I didn't mention and you're in their nursing program, and we do have some of our RN to BSN coursework available for pre-licensure, but the remaining of those courses would be, your licensure would be required. So that one we call the RN to BSN track. Usually it's going to be nine nursing courses, and we offer those spring, summer, and fall. So if you are an associate degree registered nurse and looking for that bachelor's degree, there's a lot of employers now, hospitals, that they're really pushing that you have that bachelor's, or they can't promote you until you have that. So there's lots of reasons to go back to school and get your bachelor degree. That bridge is online. We do have some projects, practicum projects that are done in your community. So you can be in Florida and work on this program, which I have had advisees do. So that's the online track. And then last but not least, we do have an undergraduate and a graduate certificate in nursing management and leadership. For the undergraduate, you do need to have your RN license already. And then for the graduate certificate, you need to have already had your BSN. So we can work with you on those. These certificates would be to prepare you to take a nursing manager credential exam. And then again, oftentimes getting that credential may make you better employable or more competitive for a management promotion. So those are the 4 tracks for the BSN. And I mean, people know nursing, right? So nursing is the nation's largest healthcare profession. And of the nurses, 84% of them are employed in nursing. And within nursing, you have lots of different branches. We have, you can do travel nursing, flight nursing. There are a lot of nursing positions that do require that you have a bachelor's degree, and then obviously some that require even advanced practice ones. So things like certified nurse midwives, obviously faculty, they're going to have a master's degree or higher, depending on what you're doing. So lots of different careers in nursing. One that I've been hearing people ask about more often too is cosmetic nursing or aesthetic. And these would be people that are working in esthetician, whether it's a salon or a medical spa, giving Botox, or just a lot of things that we don't normally consider as a nursing job. Right now for regular RNs, entry wage, and this really varies depending on where you are, $31 an hour. Management could be making up to $75 an hour. The medium wage right now that the nursing, there's a associated board that comes out with statistics every year. They said that for 2020, the median salary for a registered nurse is around $70,000 a year. I personally know someone that works over in a hospital in the Tri-Cities area. She was a graduate from our program about 5 years ago, and she's getting around $100,000 a year. So there's some really great like return on investment type of opportunities with this degree. So nursing in general, much needed. There's a big shortage. It's very easy to find a job. Some of the misconceptions that I just felt like addressing would be that nursing's for ladies, and we have around 10% of our applicants are male, and we need a balanced, diverse workforce. And so if you are a guy or a guy who's considering healthcare, really encourage him, because we definitely need a good balance of males and females working in healthcare, and especially in the nursing field. Crazy hours. Nursing doesn't always have to be crazy hours. It doesn't have to be in a hospital. You don't always have to be dealing with, quote, blood and guts. Sometimes those are your starting out jobs. But I also know nurses that have been able, almost right after they graduated, even at the associate level, some of them were getting jobs in public health. So they never had to be working those 12-hour long shifts at a bedside. We need those nurses too, but just the misconception that that's what a nurse does. And so I talked a little bit about flight nursing, telehealth medicine. There's nurses that are working from home, whether that's for insurance companies or facilities that offer a telehealth consultation. So lots of diverse options within nursing. Okay, let's go to the next slide. Okay, so changing gears now, radiographic science, that's the other degree programs that we offer. So we have a 2-year associates in radiography. There is 1 year of prereq courses. So if you were to come into LC, let's say with no college credits, we would have you spending your freshman year working on these prereqs, which are math, science, chemistry, anatomy and physiology, your English, some gen ed, those kinds of things. You would apply basically in the second semester of college, so that getting into the radiography program, you would start then for your sophomore year, graduate in your junior year. So altogether, it would be 3 years. Typically, we think of an associate degree as a 2-year program, but with the prereqs, it does, in general, would run you around 3 years, but it's 2 years in the program. Once you finish the program, you will go take your registry exam. And we've had, I think our 5-year average is around 90% pass rate for that registry exam. And so that's at the associate level, and that would prepare you to take x-rays. There are a lot of hospitals or medical facilities that will do cross-training if you have a desire to learn on MRI. Some places will cross-train on computed tomography. I know that there's a hospital cross-training on ultrasound or sonography. Most all of those will ask that you first have your radiography, your RT foundation. Not all, but in order to be taking x-rays, which again is probably the most common modality, you're going to want to have gone through an accredited program. So that's what we offer. The Bachelor's of Science in Radiographic Science, that consists of about 8 online courses, and that's assuming you have all of your Idaho general education done. And again, if you're watching and interested in getting that bachelor's, talk with me. You do have to have had your associate degree already. So you can't jump right into the bachelor's if you don't already have your RT credential or are not currently in a program. Then we have our Bachelor's of Science in Computed Tomography, and that would prepare you to then go on and take your exam for computed tomography. I try to compare it to things like a driver's license. You may have gone through driver's ed, but you don't have your license till you go take your official driver's test. Well, what happens if you also want to drive truck or motorcycle? You have to train and then go test to have those endorsements on. Every modality that you're going to learn in radiography, you would want to go, once you learn that, whether it's hands-on on the job training or you go to a specific program that's just for that modality, you would then take some kind of registry exam to get that credential. So for computed tomography, we would offer the coursework and help set you up with an internship if you don't already have experience in computed tomography. So that degree is for people that do already have their credential in CT, but not a bachelor's. And it could be for people that don't have that credential and they are able to get their bachelor's and be prepared to go take that credentialing exam, if that makes sense. And obviously, the more modalities that you are trained in and are certified in, the more wage, the more income you'll be able to earn. So careers, with Rad Tech is kind of one of the main ones, but that's not the only one. CT, MRI, mammography, sonography or ultrasound, nuclear medicine, these are all different types of modalities. And we help lay that foundation for the x-ray. And because our graduates are really well known in the area, we've got faculty that have talked with some other programs. Boise State does offer a diagnostic sonography program. It's just for ultrasound. And they have told us, they would love to see our graduates come down into their program. So if you did want to go get some specialized training just for ultrasound, which we don't offer ultrasound training, so that if you didn't get on the job training through an employer, that would be a place that you would be able to go. And again, if you're a graduate of our associate radiography program, that's going to give you a big leg in to get to theirs. So radiography can be very labor intensive. It involves a lot of positioning of patients on a table. Sometimes they can't, maybe they're immobile because they've broken something, or for whatever reason it is that you may have to help move and adjust them. So it's going to be something that you're going to want to make sure that you are fit and healthy to do. Another thing I hear is oh, I really want to do ultrasound, and I love babies, and that seems like what they have in their mind. Well, many of our radiography students, once they get into our program and they start to see firsthand what's all involved, what kind of patient imaging is being done with ultrasound. It is a lot of prostates and maybe some body parts that you weren't thinking you would be imaging. So keep those things in mind. Another thing too is if you are immunocompromised, and this was obviously a big deal with during COVID times. If you are someone who maybe has a compromised immune system, understand that in radiography, you may be imaging patients that they don't know what's going on. The doctor's not quite sure either. There could be a communicable disease, and they're sending this patient to get imaged before they are even diagnosed. And you may be one of the first people that are there to help them in this process of understanding what's going on. So, and that can be a risky situation for someone that would be susceptible to things. So there are other forms in healthcare, which I think I'll talk about in my next slide, ways that you can be involved in medicine that aren't necessarily direct patient contact. So that's just kind of an overview of our radiography program. I know that we have, if you go onto like Indeed.com right now, there are tons and tons of job opportunities for radiographers, contracts, traveling radiographers, X-ray techs. They have some contracts for 12 weeks and they're paying $3,000 a week, which just blows my mind. So nursing as well. These are very lucrative professions, and for the cost of your education, so for radiography, 3 years, and you're jumping into a job where you're making $50,000, $60,000 a year, that more than pays off your education very quickly. And then same thing on nursing. Okay, let's go to the next slide. So why come to LC? What does our program offer? Some of the things that I feel kind of put us above and beyond maybe some other programs. We have an amazing health sciences building. This was finished in 2009, and thankfully we have really been blessed by just the amount of support from the state and the school for continuing to upgrade and keep all the technology, all of our mannequins, all the equipment at state-of-the-art levels. So we have lots of equipment that if you went into any ER right now, you would see those same things. So whether it's a portable X-ray machine, some of the computer systems that we're using. So the labs here are amazing. You do need to come and see them, but we do have a video of some of our lab stuff. I will probably try and put it in the chat before we're done, just so you can view that video yourself. What kind of students are maybe best prepared for our program? Math and science is going to be some of your foundational classes, and those are grades that we look at, especially for the pre-licensure nursing and for the associates in radiography. Getting good grades, and by good grades I mean A's and B's. That's those are going to mean that you're working hard at mastering that content, because that's what we need you to do to be safe and competent. Good time management. It's going to be hard to get good grades if you don't have good time management and study habits. A lot of students nowadays are working, and it does take a lot of skill to be able to balance your time between studying and still having a school life balance. And these are not easy classes. So having those time management skills, those are things that are really going to serve you well if this is something that you're interested in doing. For anyone in healthcare, compassion, patience, team player. We're not an island, and everyone in healthcare is a team member, whether you are a small team and then part of a big team. From lots of communication and different groups. So healthcare isn't for everybody. And sometimes we have family members that are in healthcare, whether that's a nurse or a doctor or like we said, x-ray. And we need all kinds of people, and be thinking about what's a good fit for you. And if this is a good fit, talk to those people. If you can job shadow or even volunteer at a hospital, those, and getting your CNA, I didn't mention that as well. The basic track does require that you either have a CNA or that you go through what we call skills training. If you're someone that has a medical assisting certificate or EMT, we have some challenge options. But just having your own experience and what it's like to work or volunteer in healthcare, I think those are really important things to help solidify and also give you that vision for what you're working towards. Too many times I see students that they know what they want to do now, and they were a college student 10, 20 years ago, and they didn't know what they wanted to do then. And they came maybe because they were expected to, and they didn't put attention and focus in like they should have, because they just were kind of aimless. And those, unfortunately, all of that's part of your permanent academic record. So if you're unsure of what you want to do, and this is probably not something you want to hear a college admissions person say, don't go to college if you don't know what you want to do. But I want to say, find someone to talk to kind of help guide you and maybe clear out the weeds of what it is that you are interested in, and finding firsthand experiences and, like I said, job shadowing or volunteering to give you that your own eyewitness testimony of, can I see myself in this profession or not? And like I said, that helps to really develop a vision for what you're working towards, and can keep you motivated when school gets tough. Absolutely. You don't have to have heavy patient contact for nursing and radiography. Those might be places where you start out. And like I said, if you're someone that maybe you're not looking for a hospital bedside experience in nursing, there's lots of other realms of nursing that don't involve that. But on the flip side, if you aren't a people person, maybe this isn't the correct job for you. Maybe there's some other things that you could be doing. Non-clinical healthcare careers. So if it isn't nursing, if it isn't x-ray, social work. Now, and these are things, there's still people jobs, social work, counselors, even just running a healthcare facility, as we have an aging population, our hospitals, and then skilled nursing facilities, even things like retirement centers with nurses around. These are opportunities that are really going to be expanding soon, and we need people to run those, not just the ones that are doing the medical side. And then last but not least, the medical records and transcription. These are things that you wouldn't have patient contact with, not normally, unless you were just talking in a billing fashion to someone. But for coding and transcription, that would be really, you're in some of the deep layers of healthcare and understanding how it all works, but without having to, spend your time learning how to take vitals and some more closer patient contact things. And I did include a QR code here, so don't leave the presentation right now. You can take a screenshot with your phone or something and follow that QR code if you wanted to go check out our video about the state-of-the-art sim labs and just kind of a little insight into our programs. So I think that's it from me. My information's listed there, and Rosita, I'll kick it back to you.
Yeah, for sure. So I've been monitoring the comments. Doesn't look like there's any questions just yet in the comment section. So we'll go ahead and give people a couple minutes to think of some questions and ask those. In the meantime, though, oh, that's funny. We just got one in. So it says from Bill, He is graduating from Boise State this semester, took the LCSC HESI 2 to 3 years ago. Would it still count for applications this year?
So, Bill, are we talking about radiography or nursing?
We'll give him a second to
Okay.
respond.
Because it really depends.
Okay, in the meantime, we got another question as well. What are the dates for the summer CC to BSN nursing classes? And then Bill just responded that it was for radiography.
For radiography. We do allow students to retake the HESI for each cycle. So once per cycle. So if you took it, I would say if you took it more than 2 years ago, I would encourage you to do it again. But that might be one that email me at the nhs@lcsc.edu that's on the screen. And then I can maybe ask some more questions and we'll dig into that. But yeah, thanks for asking. Okay, for CCBSN summer, we will not open registration until April 14th, but we are actively recruiting for that season. So if you are at NIC, CWI, or CEI, Brian Parker is your go-to guy, and you can email him at this same nhs@lcsc.edu and say, hey, Brian, I'm at such and such a school. Because like I said, we are recruiting for that season. Registration won't open until mid-April, but there are some things and some orientations that he already has planned. So you may be getting a visit from him in your nursing class soon. I would probably expect that, but reach out to us now, and that way he can give you some one-on-one attention first.
Cool. And then it looks like we got another question in there. It says, would high school students be able to take those summer classes as well?
Any of the actual NU courses, which is our for nursing students, those are not open to high schoolers. You would, if it's one of the CC to BSN, the community college to BSN, those are for students that are actually admitted into the nursing program at that community college. So high schoolers, there are prerequisites for our pre-licensure, the traditional basic nursing program. There are prereqs that you can take as a high schooler through like dual credit or something. We do have courses offered in the summer. So I hope that kind of answers your question. If you're not in a nursing program and or you're not in our nursing program, you wouldn't be able to take any of the BSN coursework.
Perfect. And then I guess kind of with some dual credits, kind of going back to that high school student topic, what are some of the typical courses that high school students can take?
Oh, good question. Statistics is a great one, especially if you're in a math class now, and if you can get dual credit for that. We have 5, besides your regular general education core, and I mean, there's 13 different requirements on that. Your English 101 and 102, and oral communications. I recommend psychology, like an intro to psych and an intro to sociology. Those are great ones. Maybe a U.S. history. But we call them the big 5. And this would be for the pre-licensure track that's here in Lewiston, applying for that. We're looking at statistics, microbiology. We do have a chemistry that we have you taking here at the college. It's called Chem 105, and the title is General Organic and Biochemistry. That's a 1-semester chemistry class that in that 1 semester, it covers general chemistry, organic, and biochem. For the most part, it's not available as a dual credit. If students do take a dual credit chemistry, it usually comes in as our Chem 100 or 111, and then you're missing some of that biochemistry part. So I would say as a high schooler, just take a high school chemistry, and that's going to be a really good foundation for coming in and taking then our Chem 105. The last 3 of the big 5, microbiology. And then we have a year of anatomy and physiology. So we call it A&P 1 and 2. I know that there is a dual credit anatomy, A&P, that some students can take through high school. That usually comes in as our biology 175, which is a very good foundational biology class. And I think that that does a good job of setting the foundation for coming into a 200 level anatomy and physiology class. The A&P that's here at the college, you have access to our cadaver lab, some amazing faculty. So just taking a biology or A&P at a high school level, it again will help you, whether that's with college credit or not. Those are things that are going to help you be successful. And we see that students that are strong in those sciences, they tend to do better and understand some of the more difficult nursing concepts like pharmacology and pathophysiology. So these are areas where if you have a class and you can take it, do that. That's going to help you in the long run.
Great advice. I love it.
I will add to that too. If you're at a high school that they have maybe it's a health occupations course, or it's some way that you can get a CNA, your certificate as a nursing assistant or nurse's aide, those are usually very affordable options. The CNA class, it's just through workforce training at LC. Currently, it's $999. And I've heard of students that they took it through their high school and it was either free or it was extremely reduced, like $300. So those are options too that I think if you can get that ahead of time and get some patient care, some health experience with that, perfect. That's what you want to do.
Cool. And that would probably be a good way for them to know if nursing is the right fit for them too, right?
Yes.
Sweet. All right. And then Andy Freeze says, if I applied for the nursing program this fall, when will I know if I was admitted into the program?
Oh, hi, Andy. We've been emailing. We will be making admission decisions for this coming fall around mid to late March. So we will be contacting you via email with whatever email address you used on the third-party website that you applied on, which is called nursingcast.org for anybody else that's interested. Nursing and then the letters CAS.org. So nursingcast.org is our application. So there is a separate application when you're ready to be applying straight into the nursing program. So that's different than your college application. Nursing Cast is where every semester we have an open window to apply for the nursing program coming up the following semester. So right now until February 25th is our window for anyone ready to apply to start nursing in this August. For sessions beyond that, we usually have our windows starting April 1st to September 25th, and that would be for a spring start. And then, November 1st to February 25th for fall.
Cool. All right. Okay, and then it doesn't look like there's any more questions, but again, we'll give it another minute or so. But I do have one. So if students wanted to tour the nursing facility or radiographic science facility, are they able to do that? And what would they see?
Yep. So reach out to me at the NHS and I can coordinate with you on times. I have been known to come in on a Saturday if there's someone that really had a hard time getting down here during the week, but the admissions office does offer some Saturday visits. So nursing and radiography, they're both here in Sacagawea Hall. The nursing, we have a huge, we call it our clinical resource center, and it's the skills lab. This is where students learn their really foundational nursing hands-on skills. And in that lab are low fidelity mannequins. So these are mannequins that they don't have all the computerized inside parts like our simulation suite does. So we have the clinical resource center and then the simulation suite with, we have two sides now. So we have a full-on med surge side, which looks a lot like some kind of hospital floor with 4 patient suites and, you know, very, very expensive robots in them that are extremely lifelike. When they're turned on, they look to be breathing, their chest rise and fall. We can make their tongue swell, their pupils dilate. You literally could feel a pulse in one arm and put medications in another. There's microphones inside. So when the students are in a simulation, and if you can time it right on your visit and actually get to see a simulation going on with the students, that's even better. We voice the patients. Sometimes we have people in the room acting as friends and family members, and so they'll be playing a part. We've had drama students participate. We've had social work students come in and participate. So that's one side of the sim suite. Across the hall is our newly added maternal health and pediatrics. So we have our sim mom, and she was giving birth today. So students were practicing labor and delivery with her. And then our pediatric simulation, we have baby, toddler, adolescent. One of the partnerships we have for students that are in our pre-licensure program, they have a clinical experience at a pediatric hospital in Spokane. So that's an exciting experience that we're able to kind of offer to students, that a simulated child is nowhere near what you're going to have in real life. So for them to get to go to a NICU, to a pediatric hospital, those are, you know, priceless experiences. So nursing, I just said, clinical resource center, simulation suite, and then for radiography, that radiography suite is in the same building. And so in that room, we have 3 rooms with real imaging equipment. They're lead-lined walls. The students can be in there. And when we're teaching them how to take real x-rays, most of the time the machines are all off because you can't practice on each other. So we have mannequin body parts. We call them phantoms. So phantom body parts that we are able to take real images of. The students all wear these little badges that keep track of all of any radiation if they have been exposed to anything, and we track it all. So that's a really neat lab. It seems like a lot of the students, when they're in there, they're working with each other like a patient. They're doing role playing. A lot of it's positioning. So if you were to come by on a day that they were in class, we get to see them positioning each other. They work in the dark a lot. So that's kind of a funny thing, but they have practice tables that don't produce radiation. And so that'll be the ones that we'll normally see them laying on and getting moved and maneuvered, and then their x-rays taken. But yeah, it's kind of an exciting place. There's a lot of like kinetic energy things are going on all the time.
That is awesome. I always get so excited when you talk about that too, because it is a really cool facility.
It is really cool. And sometimes, I know for me, I take it for granted until I go and I tour other colleges and I see their facilities for, usually it's for nursing. That's when I realize how nice ours is. It really is nice, but you do have to see it with your own eyes and to get a feel for it.
Very cool. And I'm really glad that you mentioned the Saturday visits, because we do have another Saturday visit coming up on March 4th, and then another one April 1st. And then there's another one in May. So if anyone listening wants to, come check out the campus, tour the campus and the nursing facility, that could be definitely arranged, right?
Yep.
Sweet. All right. So it doesn't look like there's any more questions, and I don't have any more on my end. So thank you, Tiffany, so much for all of this information and for joining us tonight.
Yeah.
And I guess that will conclude our information session for tonight. So everybody, thank you so much for joining us. Stay tuned for our next info session happening on February 22nd. And that will be with our Physical Life Movement and Sports Sciences division. So they have a pretty long title as well, but they'll have some really great information as well. So February 22nd at 6 p.m. Pacific Standard Time. Thank you, everybody. And thanks, Tiffany.
All right. Thanks, Rosita. Bye, everybody.